Hello, beautiful people, and welcome back to another episode of Two Girls, One Doc.
One Doc.
It's your girl, BD.
It's your girl, Four Ends.
And we back.
Like crack addicts in rehab.
We sure are. We're back. Today's is actually quite a serious topic. Also, Christmas is tomorrow by the time you're listening to this.
Oh, it is.
So, Merry Christmas.
A very Merry Christmas and a happy... No, do you remember the JLS?
JB, yeah. Merry Christmas. Just unprovoked from nowhere. From absolutely nowhere.
And guys, it's not Christmas if you haven't listened to Mariah Carey. That was the wrong song.
I don't wanna love for Christmas.
Yeah, Last Christmas was the George Michael one. Slyly, I think it's a better one. It's a better Christmas.
We don't have to pit two bad bitch songs against each other.
It's true.
We can just enjoy both.
Oh god, it's coming up to his anniversary.
Yeah,
that ruined my Christmas that year. We were all mind our business, and then I just screamed and fell. I literally screamed and fell on the floor. I was like, George is dead. They were like, who are you talking about?
You're so
dramatic. It's like George Michael. Only my dad really loves George Michael in this house.
How did he take it? Did he also fall to the floor and cry?
He was like, no, you're kidding. Put on BBC. And then we were just like, wow. And then he was like, well, he was living a fast life.
So today we are covering the documentary Is COVID Racist?
Yes.
Which can be found on Channel 4. Maybe not by the time you watch it, actually.
Yeah,
when I was watching it, it said 7 days left. I need to edit this quick. Yeah, so you can probably maybe find it on YouTube. I don't know. Type it into the internet and see. But I think it's worth watching. How did you feel about it?
I really like this documentary. Not the subject matter, obviously.
Yeah.
But I enjoyed...
But the angle.
Yeah, the angle and the learning. And I also really liked how it was shot. It was very interesting.
Yeah, same.
I can't lie, initially, when we had it on the thing, I was like, okay, this is relevant, so we'll do it.
Yeah,
but I wasn't
it's not
really
going to be enjoyable.
Forward to it. Yeah,
Mm-hmm.
but I actually really enjoyed it.
Because we do a lot of silly. Like, if you look at our past few episodes, they're just very silly, very, useless. Do you know what I mean? But we're not, you know, one-sided. We have variety, multiface. We are multiface, and you know, we just thought let's do something a little bit more serious.
Do a little serious.
And it is very relevant right now, especially you know, Christmas and that. So this documentary is actually hosted by Dr. Ronks.
Mm-hmm.
And Dr. Ronks, I went to go and stalk on Instagram, and their pronouns are they and them. So I'm going to do that. So if you hear that, that's what that is.
I pre'd them too as well.
Yeah.
Good content.
Do you know? I actually met them.
Where?
I met them. I don't know if they'd even remember me, but I was working at an independent in East London, and they were there speaking with the lady who runs that independent. Yeah. So
Do they follow you on Insta?
No. I don't. They probably don't even know who I am.
Yeah.
But I remember them because I remember at the time they were talking about a documentary that they had coming out.
Oh.
Yeah, and I forgot all about it. And then when I saw the trailer,
then you were like, oh shit.
I was like, oh, that's them.
Yeah, but they have a very striking.
Yeah, you wouldn't forget. Yeah.
So you
appearance.
Like,
you wouldn't forget. And that's why I was so sure. I was like, I've seen this person before.
Yeah.
Exactly. And then their voice, I was like, yeah, I know. Anyway, let's get into it, guys.
Sorry, do you think they're Nigerian?
Oh, definitely.
Oh, okay. Cool.
I think so. Yeah. Because Ronks, I'm assuming maybe Ronke.
Yeah.
And then Ikaria, that's Nigerian.
Oh, I didn't. Okay, cool.
The surname, that's Nigerian, I'm sure. But yeah, I'd like to claim. So
I would like to see it.
I would love to see it. So this documentary covers the disparity between the deaths of NHS workers, right? So as we all know, I'm sure you all know, if you don't know, where have you been? Black and brown people are dying at a much higher rate than their white counterparts. That's what this documentary sets out to uncover. Like, this is happening. Why is this happening?
Yeah.
Right? Okay. So the doc opens up with Boris, the man leading our nation, bragging about...
Luckily, we only hear his voice. We don't see him.
Yeah, because it's too much. I can't
deal with his windswept
He's just
hair
very
and
dishevelled.
his ill-fitting suits.
Yeah, it's rude. It's very disrespectful.
Oh my God.
He's bragging about shaking the hands of coronavirus patients.
This is where I see him and Trump have that crossover.
They're the same person.
They're the same. Literally, they're the same.
One's
person.
just like brash and American, and one's just
and
like
orange.
Yeah. And orange.
But when I was talking about it today, we were just like, I don't understand how Trump looks in the mirror and he doesn't see that he looks like a Cheeto, and I don't know how Boris looks in the mirror and doesn't see that his suit doesn't fit and his hair is very
like. Are there no combs allowed in the White House? The White House, you know, down the street. Both of them.
I don't know. Combs, no tailors.
No tailors. He said tailors. No, they're not key workers, boy.
Mm-hmm.
So we learn initially the first victim to COVID-19 we learn about is called Arima Nasreen. And she's a nurse who contracted coronavirus in March. So this was, March was like when it was the end of March that they started doing up lockdown.
Yeah.
So beginning of March, that's when the rumblings were getting a bit louder because people had heard about things from like end of last year, beginning of this year. Because I remember my flight to China got cancelled with quickness. It got cancelled in January. And they just gave me my money back, no qualms.
But you know what? I wish I could go back to that time because I remember, I literally remember I had just come back from my dirty December.
Fam.
And then I was standing at because my old office had a massive TV screen.
Oh yeah,
and then you could watch news and stuff. And then so it was switching between Kobe Bryant and the COVID. Oh my god! And then I was obviously still deeply mourning Kobe. I remember being on the way back from work and crying on the train because I was reading stuff and it was very upsetting. And I remember seeing the COVID stuff and I was just trying to need to hurry up and get this
sort it out.
But maybe it was naive of me. I just didn't think it was gonna travel out.
I didn't think it was that deep.
Yeah.
My dad was telling me about this for time, beginning of the year.
Yeah.
He was like, you're supposed to go to China. This COVID thing, hey,
But
and I was like, all right, Dad,
going
whatever.
Into the war zone.
But I didn't think it was that deep anyway.
I
was just kind of it's a virus or whatever.
I just didn't think. Because we've been in, to be honest, I just didn't think it was going to spread the way it did.
Yeah, exactly. I don't think anyone anticipated it. But then I do think that people did anticipate it and did nothing about it.
Yes.
And now we're where we are. So me, as the Jack the lad, a commoner, it's not for me to anticipate the spread.
That's why
that's not my job.
Those jobs.
That's not my job. That's above my pay grade. Do you know what I mean? It's really above me now.
I do my
job. So, we don't meet, unfortunately. We learn about Arima Nasreen. She's a nurse. She contracted coronavirus in March. And we see videos of, it's just, how you can just see videos? Mm-hmm. You can just see somebody so alive.
God, I tell you, I go through that every day with my own situation. Ugh. And the worst is when you see videos of them talking.
You hear their voice.
And literally I'm like, but he's right here. If I jump through, is there any way I can jump through the
screen? Jump into the screen, back into that moment.
Yeah.
It's
crazy.
So we see her graduation video. Sis got a first. Come on, shout out to you. And we hear how excited she was to start working with the NHS, and she's wearing her uniform before she even starts because she just kind of wants to get into the zone of it. And she's only on her third shift when she starts getting COVID symptoms.
That is so sad. You're barely in there.
Barely in there. She gets put on a ventilator. And she's not old. She's 36.
Yeah, 36.
She's 36. She's one of the first nurses to die because of COVID. And we find out that Black, Asian, minority, ethnic backgrounds, NHS workers are most likely to die. Apparently there are no actual figures of how many have died. But the documentary reports there are about 200 NHS workers who have died in total from COVID, and 2/3 of them are from BAME backgrounds. And I am using BAME because that explains the group of people who are suffering from this disproportional dying from COVID. I don't really like that term in terms of describing myself.
Yeah, I do.
But I'm using it now because that is it really does describe what's happening here, right?
What's happening here?
What's going on here, love?
What's that thing that guy tweeted?
Which one? The American
British people.
They're like, oh yeah, British people. I love when British people say what's going on here, because what really is going on here. No, and that's what we're trying to find out. Yeah. What really is going on here? So the explanation that they come up. They is in the government, is in them's in the back,
Gosh.
They say that it's to do with genetics. We are predisposed to COVID because we're black because of genetics, right? Yeah. Even though we're young and healthy, as Rima was, only 36, healthy, we're more likely to die because of our genes. So every black, Asian, minority, ethnic person has the same genes. Is that what you're telling me? Mm-hmm. Okay, cool. Maybe they do. I'm not a geneticist.
But we speak to one.
We do speak to one.
So
we do speak to one.
Let's debunk that quickly.
We do speak to one. I mean, we also speak to what's his name? Doctor. Let me not be rude. Dr. Winston Morgan. Winston. He is a reader, toxicology, and clinical biochemistry. I think that's what his doctorates are in. Okay. His lower third was a lot. Yeah. He's qualified, is what they're telling you.
He's studied.
He went to school and he did well.
Oh, he got money.
So Dr. Winston shows us some statistics that state that black men are 4 times more likely to die from COVID than white men. And it's why is that?
Yeah.
I would like to see it. Houseway. Do you know what I mean? So Dr. Winston tells us that
race is basically a limited number of phenotypic characteristics. For example, skin color, hair texture, facial features, those kind of things. But none of those characteristics are linked to why you might be infected by COVID. Whether you're infected by COVID, once you encounter the virus, it's going to be determined by your immune system, which is a totally different set of genes. Nothing to do with the genes that determine your skin color, for example.
Yeah, genetics are important, but it's not even the genes that are linked to race that matter.
Exactly.
It's the genes that are linked to your immune system that matter. So maybe you're right in terms of genetics, but that's got nothing to do with race. So like, what's really good? Do you know what I mean? Like, it's easy to just say, oh yeah, genetics. And it's easy to like just use like jargon because the general public won't understand that.
Yeah.
Dr. Winston makes a point that all black people are grouped together when even like East Africans, West Africans, everyone's different.
It's a different genetic makeup.
Exactly. It's a different genetic makeup. So like, what are you really saying? Do you know what I mean? It kind of just further proves this point. And then we hear the statistic that when age is taken into account, black people are 4 times more likely to die than white people, and Bangladeshi and Pakistani people are 3.5 times more likely to die than white people. It's wild. Like, it's actually wild. Like, I mean, it's a lot of statistics in this documentary, but I think they're very relevant because they just help you to understand what's going on.
Yeah, because if you don't see those stats, you don't know the depth of the problem.
Exactly. And it's all just like hunky-dory, ha ha ha. It's not my face, it doesn't really matter. We hear Matt Hancock. Matt Hancock is talking about people being mad about racial injustice. He basically says,
right across the world, people are angry about racial injustice. And I get that. Black Lives Matter.
Black Lives Matter.
Thank you.
And I don't believe that he means this because we already know that he can fake emotion on live television.
That wasn't, but
when he was fake, he's the one that was fake crying, innit? Well, Loki, fake crying.
Yeah, that's what I was about to say, because I wouldn't call that fake because it implies that like it was believable. Nobody was buying what you were selling, sir.
But he tried. He faked cried.
Yeah, he tried to,
but he wasn't. It's like, get off the stage, sir.
Literally.
Boo.
Stick to the stuff you know. Don't mess with.
What does he know? What does he actually know though?
I don't know, but it's definitely not acting.
If you wanna be cool, High School Musical
is everything.
It was a great time in our lives. What were we worried about? We had zero worries.
I remember like the wait between High School Musical 1 and 2.
Yeah.
And I was like, what's gonna happen with Gabriella and Troy?
Yeah.
And then Gabriella came with the short hair and I was like, oh my god. And
my only worry and concern at that time in life was learning. We've got to work.
Oh yeah, the dance.
Work this out.
I remember being like, just let Troy sing if he wants to sing.
But you know he was never singing. It was that guy. It was Drew, everything with the black hair.
Yeah, I heard.
I don't care, man. Troy did it for me.
He did it.
He did the damn thing. He's part of the culture forever. Yeah. So the next victim of coronavirus that we hear about is Josiane Ekoli, who was also a nurse.
Oh, this was really sad.
And I think it was sadder because this could have been my auntie.
Yeah.
It could have been my mum.
It could have been anyone.
It could have been that woman that sits next to me at church. Do you know what I mean? She had 5 kids and the youngest, I think, was 16 years old. That's the only age that they state, so I assume she's the youngest.
Yeah.
And we hear how great of a mum she is. Do you know the bit that I was proper sad about? Like, the 16-year-old was like washing rice, and she was explaining like, oh, my mum says, you know, you have to wash rice because if not, it's gonna be starchy and stuff like that. And it was just like, these are just the little things that you don't even realize at the time, but you hold on to, you remember.
It's telling you.
And you shouldn't have. Isn't in this case like it shouldn't have to have been that now it's a memory that my mum's telling me to wash rice, rather than me hearing my mum's voice telling me to go and wash rice and me being annoyed by it. Do you know what I mean? It's so sad. Like, we see a clip of her dancing at church, and it just makes you think like, rah, like you
were a mum.
Yeah, you were a whole human being.
Like, you
that
mean
didn't
so much
have
to someone.
To so many people.
That's why I hate this stat. Not like because I said it to you as well. Like, when you look on the news and stuff like that, you see like the other day I was watching news and it was like, 1.2 million people around the world have died of COVID, and I was just like, it's kind of like, I know nobody can sit there and say everyone's name.
Yeah.
But when you just see stats like that, like I remember before my grandpa passed and I would see stats. It's not that I didn't care. It obviously made me be like, this thing is serious.
Yeah.
But it's kind of like, it rolls off your like back because it's like...
Because it's just 1.2 million people.
Yeah.
It's
but
like...
then when it's someone you love, you're like, no. That was my granddad.
You're like, how can you not?
Yeah, acknowledge that he meant so much to so many people. Like... It's very, someone you love dying and becoming a statistic is horrible.
Wild.
It's the worst.
I feel like it just adds insult to injury almost.
Yeah.
It's really, really sad. Like, she is working long shifts and she gets sick. She gets admitted to the ICU, but she still kind of feels like she'll be okay. And I think everything just gets worse. And then like 4 days after being in the ICU, she passes away. I feel like we should touch on this next bit because we see her kids, and especially like the older ones are saying they don't feel like she was being protected. And they don't feel like the NHS was trying to find solutions to her concerns or for her feeling, protected. Because her daughter then goes on to say,
so it's either you do it or you don't. You can go home, but you're not getting paid.
There's no furlough option.
Yeah.
There's nothing like that. And as a result, you've now succumbed to the virus. Yeah. And I understand, like, working in the NHS, it's difficult. They're short-staffed. They're under thingy. That 250 million they said we were going to save for the NHS by leaving Brexit. Where is it? I don't know. And it's just like, it's so unfortunate because it's like,
these are people's lives, and then they're doing work that's saving lives, and you're not even protecting them.
Exactly.
And then isn't it flipping? Was it Hancock or who that just got £45,000?
Oh, what's his name? The one that drove to.
It's worse and worse and worse. And then Boris saying he's underpaid on 150,000 he earns a year.
Yeah,
it's all a joke.
I just want to
giving their mates all the
contracts and stuff.
And it's
so blatant.
There's a word they use for it here, and I was watching this clip, and the girl was like, they call it this or that, but if we were in a different country, or in like such as Africa, there's another word we use for it. And
corruption.
I'll leave you guys to.
Yeah, definitely corruption.
Did somebody say corruption?
Did somebody say? So the title is COVID racist, right? Yeah. And I think we touched on this at the end, but I feel like that title is clearly meant to like grab our attention, like, oh, of course COVID is not racist. How can a virus be racist? But I do feel like medical racism is definitely a thing.
Yep.
And I do feel like that contributes to the high death rate in people who are not white.
Yep.
Right? I remember I've seen a tweet, I don't know, maybe recently, like within the last week, someone was saying that they were told, to go to A&E if their lips turned blue or something.
Yep.
And as a black woman,
your lips are not
or as someone with darker skin, my lips will never turn blue. They will never turn blue.
Yeah.
And so I feel like it's almost as if, like, even within medicine, like, deeply rooted is
racism.
Yeah.
And even that racism can be just from the fact that the medicine is designed to cater to white people.
It's like if you don't present in a certain way, then they don't know what to do about it. And that's wild. Like, everyone is entitled to healthcare, to good healthcare.
Yeah.
Like, diseases are going to present differently on my skin than your skin. Do you know what I mean?
Literally. So why should you not?
So why? Yeah, exactly. So why should there not be like either your lips will turn blue, or they'll feel cold, or they'll whatever the spectrum might be. I'm not a doctor. Please don't come for me. Yeah. So we meet a doctor who makes a really good point. It's kind of like trying to keep with the cycle here. So people in the BAME community tend to be key workers, right? So they're more likely to be key workers, and as key workers, they're more likely to come into contact with COVID. And so therefore, BAME people are more likely to come into contact with COVID already as a result, right? And I think another thing to consider a point that they make is that people within BAME communities are more likely to live in poverty or overcrowded places, less likely to be able to shield. They also need to work because they have to make that money. They can't just quit or like if they can't be furloughed, then what can they do? And so like you have to go to work. And then someone made a point saying that people from BAME communities are also less likely to be furloughed than their white counterparts.
Yeah. And also I feel like even outside, obviously this documentary largely looks at like the key workers and stuff. But even outside of key workers, we all know that like immigrants and like people in the BAME community do a lot of the like, I don't know if it's like hand-on jobs, if that's the word. And those jobs require like, you can't work from home if you like collect bins or whatever.
Yeah, if you're a cleaner or something.
Or if you're a cleaner or stuff like that, you have to literally, and obviously because of COVID, cleaners are more necessary. And then a lot of them, they made this point, are on 0-hour contracts.
Yeah,
and if you're
which is wild that's still a thing.
Wild. And if you're supporting a family and you know that, okay, this week they're telling you to come in for 13 hours because of COVID, and you know that when COVID dies down, you might be getting 4 or 5 hours. Of course, you're going to go and work for those 13 hours. And then you therefore expose yourself. You come home and you're in crowded housing, probably living with like your
other family members,
families who are
other adults who are also having to go out
and they're high whatever risk, and then that's how it happens.
Yeah.
So that's what I mean. This documentary is very interesting because you don't make that link. And I was even thinking about it the other day, like when I went to like Dubai and stuff, and I was like, oh, I need to self-isolate and stuff. like even the fact that me self-isolating in my house is a privilege,
yeah,
because a lot of people don't have that.
Yeah.
Like, how many people have enough rooms that
Yeah.
you can
You
literally
can
be in
by yourself.
one area of the whole house by yourself, and
yeah.
so again, situations like that, if someone's exposed, and they're sharing a room with 3 other people,
exactly,
what can
and
they
then
do?
if those 3 other people also have to go to work,
exactly,
and so now that there's a possibility that there might be that spread.
Mm-hmm.
And so I think while it's obvious that a virus is not racist, I think the whole point of this documentary, and what it does really cleverly, is just highlights all the problems that were already there, that have already been there, that COVID was just like, hey look at me, this is exactly.
Even, can I just say another thing as well? There was somebody who mentioned this stat, and basically they were talking about the statistic,
babe. I know, I hate that word. Yeah, I got used to this. I got used to this. It's late.
Black and like Asian people who live like in poverty,
yeah,
and stuff like that.
Yeah,
and then
or like overcrowded housing.
Do you know only 2%
of white people?
So can I just say, like, because there've been a lot of conversations about race on like Clubhouse and stuff.
Mm-hmm.
Can I just say, like, when you as a white person say you don't understand the privilege because you didn't come from money,
I'm working class, so blah, 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 blah.
Understand that it's there's a massive privilege, because how can in the whole country only 2% of you live in poverty and overcrowding? It's ridiculous.
It's wild. It's actually wild. And like, I know people think, oh, immigrants are coming and taking over my country. We are still the minority. Like, we're actually still the minority.
And I think this also highlights a lot of immigrants do the jobs that
especially within the NHS.
Literally.
Especially within the NHS. Mm-hmm. As somebody who has worked in the NHS, yeah, especially within the NHS, like all the nurses that you see, and they even talk about like Filipino nurses as well.
Yeah.
People come in on like NHS visas. And do you know when they said that people come in on NHS visas, I thought, oh, this is like an incentive to get people to come.
No.
It's an incentive to get people to come, but they still have to pay for the visa. Thousands. Sorry?
You're herding them over here, not protecting them. It's almost like you're leading, it's like cows to slaughter.
Yeah.
It's so, this
it's
country.
so wild.
You think slavery is dead, but
it's just been rebranded, man.
Rebranded.
It's crazy.
That bad bitch really did rebrand.
Fam, slavery. She said slay. Slay. So next we meet, I'm gonna call her Dr. Auntie because she's definitely an auntie that I could have. Yeah, she's literally a babe. Her name is Tallulah Oni, who is an urban epidemiologist, and this is the people that we need. We need epidemiologists. These are people who study the spread of diseases and things like that, and like statistics and stuff. Yeah, like okay. I pray that's right. Please, guys, don't shame me. But it's that kind of stuff, like the rate of infection and how many people are, whatever. Okay, cool. She's at the University of Cambridge. Shout out to her.
Okay.
And she says,
it's not good enough that we overall are a high-income country. Our measure of development should be our ability to close the gap between those who are most able to keep healthy and the most vulnerable in society. And as long as we have this wide gap, I don't think we can call ourselves developed in any way.
Yep.
She's preaching. Because how can you say you're a developed nation when the disparity between people who are healthy and people who are vulnerable is yonders miles?
Wasn't I even reading today like that how this is the first time ever that UNICEF is now
giving. But I read it, but I said, what? So what have they been doing all this time? What did they do?
What, helping kids in the UK?
Where do they help? What kids do they help?
Other countries.
Africa,
Asia, like all of them.
But this very UK.
This very UK.
But that's what I'm saying. It's like, does charity not begin at home?
Fam.
Like, I'm not saying...
But even forget charity. Like, we are one of the wealthiest countries in the world. We are a superpower.
No, and that goes back to what Auntie's saying, because it's like, how can you call yourself developed when you can't even feed people? To give people children's free school meals, you people are flogging Marcus Rashford. Flogging him, saying why.
Can you imagine?
You have to do a U-turn to come and say yes again.
I can't believe that was even something that was discussed, whether kids should have free school meals.
It doesn't make any sense.
So they're happy. It doesn't make any sense for kids to go hungry.
Because do you know what it is? I was talking to someone about it, and I was like, maybe they just cannot fathom a life that there are people who can't. But then
you shouldn't be leading
the person that I was speaking to was like, no, of course you can understand. It's not easy to understand that. You just don't care.
Yeah.
You just don't care. You have no sympathy. It's like when you're saying to your mum, yeah, but I really want to go to this party. They can understand why you as a child would not want to miss out, but they don't give a fuck about whether you go out with your friends or not. So they don't care.
I don't know what I feel like, but But
it's really exhausting.
Burn it all
man.
down. Start again.
Just start again, man. They briefly touched on the whole scapegoating thing. So members of the BAME community, basically there's one guy on the radio, I don't even remember who it was, I wasn't going to rewind to find out, basically saying that like, oh, it's black Asian minority ethnic groups that are like, you know, not taking it seriously. And then the night before Eid, they're like, oh, yeah, no, you can't mix households, as if like that's the reason why. And that's what I'm saying about racism. Yeah, it's not, anyway, we get into this later on, about it's not as overt as it used to be. It's very, very covert, but these are the things that are racist. These are the things that are racist.
It's true, because like now there's this whole scramble to lift the lockdown for Christmas.
Yeah.
And then before you say something like that's like, oh, people from different households can't mix, and you come out and you say Asian and black people are not taking COVID seriously, when the reason why COVID is spreading amongst those communities once again is they're doing those jobs. You guys don't want to do it.
That's what I'm saying. So you are blaming them
jobs.
without looking or investigating or trying to understand why that is. Exactly. Like, let's look beneath the surface of your racism and figure out what is really going on. Like, the roots run deep. There is a problem. There's an institutional problem here.
Literally.
It's just exhausting, man. Like, how many times must I explain this to you? It's like you don't want to understand. You don't want to understand. And that's why we're going round and round.
Wrong. What's that?
Loud and wrong.
Literally.
Loud and wrong. Ugh, I hate it, man. Yeah, we hear a bit about the Filipino community, as I mentioned before, but loads of them. I think at one point, like 20% of the workers that died were Filipino nurses,
which is know this was happening. This was
wild.
So underreported.
Yeah, exactly.
I had no clue this was going on.
That's what I'm saying. I feel like this documentary was so good in that it literally collated all the information you needed and said, here, learn, do better. Literally.
Fuck everything. What you're being told in the government.
Yeah.
You as an individual think and
do better. And just check your biases at the door. So obviously, so far we've been talking about people from poorer communities. We've been talking about, like, you know, frontline workers and stuff like that. But then we also kind of touch on the fact that, like, big doctors are also dying. There's not big doctors who are living in crowded houses. That these people are presumably wealthy, exactly.
But also, can I just say with the Filipino one as well, the girl was just saying how, like, and the one, I forgot what his name was.
Yeah, the one who's in charge of the Filipino Nursing Association.
He was basically saying that, like, something that happens as well is that a lot of these workers, like, that come from Filipino, like the nurses and stuff like that, they're obviously afraid of pushing back on certain work.
I remember that bit.
They're afraid to lose their visas and their, like, sponsorship.
And so when they said, I thought that, you know, they get the visas for free because they're working there. No. But they're still having to dedicate money to their salary, from their salary to pay for the visa, and then to die.
They're afraid to do it. And then the one of the women who was a nurse, she was talking about how she has obviously her family at home and her son at home, and she was just saying that, like, any extra shifts they have, she takes it because it's more money, so she can send more money back. So you're stuck, and and she also says that, like, people think, like, immigrant workers, that this is the reality of being an immigrant worker. You don't come here to squander or steal. You literally come to work and send money for a better future for your family.
Exactly.
And this is the scary thing, because there's a lot of bullying, like, based on race that happens.
Yeah.
Because obviously you will tell those immigrant workers that you don't like for your racist reasons to do a lot of the jobs that will expose them.
Yeah.
With minimum PPE, whilst you prioritize,
especially at the beginning times, like them March times when masks weren't really a thing and there was shortages and stuff, and ill prepared. And this is what we were saying, you know how we were saying at the beginning, like, oh, we could have never foreseen this, or like, how are we gonna know? Like, nobody's gonna know. Like, how are we gonna know? But like no, like they should have known.
Yeah,
like it's
and they did know.
Yeah, exactly.
But for them, the bigger thing was the economy. Yeah,
it's different from me saying, oh, I didn't think it was that deep, to the government
who had all the stats.
Exactly.
And they knew that people were coming in and out of these countries where there was exposure. Anyhow. Up and down.
Up and down. We learned that the first 10 doctors that died from COVID were all from Black, Asian, minority ethnic backgrounds, which is wild. They touched on structural race inequality, which we touched on as well earlier. But also we'll touch on again soon. So we learn about Mary, and I remember when this happened. I remember when this happened. And I just... like, pregnant Black women dying, it just makes me so sad. Yeah. And I think, yes, there's an element of selfishness, because that could be me, right? And I just think that it's just wild. It's just wild.
The videos of her and her kids was very sad, because I was just like, those kids will never know their mum. Can you imagine?
It's actually wild.
And then the thing that's annoying, because, like, I'm not saying someone dying of cancer isn't sad. Obviously it is, but cancer is an ongoing thing. People are suffering from it. One day, like, COVID will be not gone because it always probably exists, but
it won't be the pandemic that it is now.
Yeah,
let's hope so. Boys.
And then you'll just be thinking that if only they had survived this period,
exactly.
they would be here. That is the most difficult.
But then, so all roads lead back to the incompetence, because had everything been like
China,
well,
yeah.
I mean, that,
but somehow that Wuhan, the nightclubs are open.
Yeah. But what I'm saying, what I'm trying to say is, like, had everything been done earlier, it's like, this is definitely not the same. But when you get to an exam and you're ill prepared and you're like, shit, if I just started revising earlier, like, we wouldn't have to be here.
Yeah.
I'd actually be fine. Literally, if everything had just been done earlier and at a better quality, how many lives would have been saved? That's the thing. Like, it's not to say that COVID is not that deep and that no one had to. Like, I understand that people probably would have succumbed to COVID, but I feel that maybe the numbers wouldn't have been so high and there wouldn't have been so many needless deaths had you just done your homework.
Yeah, if you've done your job. And I don't even think it's not that they didn't do their homework. They knew. This is what I'm saying. They knew.
Oh, you think it's thinking that they knew but they didn't do anything? They were just negligent.
Because I know that for a fact that they knew. Yeah. They just chose the economy over the lives, which is exactly what happened.
That's wild.
We should have gone into lockdown way earlier than we did.
Stayed in lockdown.
And stayed in lockdown.
And then you bribed us to eat by giving us £10, so we weren't going to go eat. Bam. Then you blamed us for going out to eat when you gave us the money to go eat.
And then it's in and out. Snip, snap, snip, snap, snip, snap. Fam.
Oh, my goodness. So Mary is a nurse who worked for the NHS. She was pregnant and she died from COVID. But luckily, praise Jehovah Jireh, she was able to have a C-section so that her baby could be born. But she died shortly after that.
I think it was the C-section.
I don't know.
No, I don't think.
I think she died from COVID.
Yeah,
after. But they were like, "You've got COVID. Take the baby out."
Yeah.
Yeah, I mean, no, just cut the thing and grab the baby out. Do you know what I mean? What's that got to do with COVID?
Because don't you require quite a lot of energy to heal from that, and you're already suffering. I don't know,
man. Just chuck the baby out. Just grab the baby.
I'm no medical doctor.
I mean, even.
Just cut the baby out.
Grab the baby. Just grab the baby out. Yeah, good things. So luckily she was able to have the baby. And now her husband is actually left with like two
kids.
It's so sad. But last people that we meet is this couple, two doctors, and I really liked them. I felt at first the husband wasn't really saying much, so I was kind of like, why is he here? Yeah. But he spit game at the end, literally. So Dr. Ronks asked the husband, why do you think BAME people are dying? And he says,
racism. It's years and years and decades and centuries of inbuilt racism. I think it has to be said in really explicit terms, just to really paint out. It's really difficult to say this act was racist because nobody uses the N-word anymore. Nobody calls us pakis like they used to. But those people didn't disappear. They became our bosses.
I was like, this is
it.
I was like, that drops mic.
Literally.
Because I was like, I literally, out loud, I was like, whew. And I reclined.
That's it. Racism isn't gone because we're not slaves.
Because you didn't call me a nigger.
Yeah, literally.
That's not it. That's got nothing to do with it.
They're still here. They're still here, and they're still the kids of the kids.
And so this is, even with Black Lives Matter, this is institutional racism.
Yeah.
It's that it doesn't go away. It's that it's embedded into the fabric of society. It's embedded into the culture. It is Britain.
So literally it's just like they took away the overt racism and they're like, okay, we're going to repackage this in a way that you're not really
can't
sure
win.
And you can't win.
And you can't prove. It's like gaslighting 24/7.
But we're still going to make sure that the white people are.
It's wild.
Best taken care of.
It's so wild. And I just think to myself, like, how can it ever change? Can I remove just one thread of your fabric now? I can't. It's all interwoven. It's in there. You have to throw the whole jumper away.
You have to throw it all away. This is the thing. I genuinely, like, when I think about things, I genuinely don't feel like things will ever get
better.
Yeah. And I do, like, remember
ever truly change.
Yeah, I remember we did the like whole social media documentary.
Oh yeah.
And they were like,
the social dilemma.
Yeah.
Yeah, you should listen to that. That was a good episode.
Listen to episode. And they were like, there's gonna be like a dystopian like future.
Yeah, that's what you think.
I believe
that.
I think something is gonna happen, like a major war, and then
So where are we going? Where? Maybe what we should do.
Oh no, we're not going to be live at that point. It's going to be.
Oh, it's going to be after we're gone.
Yeah,
okay.
This is my grandchildren.
Okay, that's not my problem. None of
Not
my
my
business.
problem.
None of my business.
I love y'all, but it ain't my problem. Because one day they're going to listen to this.
They're going to listen to this. Yeah, be like,
grandmas. Is
this
how you doing us? Yeah.
So the documentary is drawing to an end now. We get a statement from the Secretary, wow, it's late. Secretary of State for Health. He declined to be on the documentary. Surprise, surprise. They love a statement. Anyway, so the statement reads...
Notes app.
They love Notes app statement. We know that COVID-19 has had a disproportionate effect on people from BAME backgrounds. The government continues... Okay, by continues, that means that you were already, but okay, we move. Continues to take actions to address the disparities that exist across society. Why do they exist across society?
Exactly.
How about we address that first?
And you know why? Let's start doing work that matters.
Come on.
Yeah.
Come on. And so, speaking about doing work that matters, they've launched a commission on race and ethnic disparities. They love a commission. They love a commission. And then nothing happens.
Fuck all, but commission.
Sandwiches and tea.
Literally.
They love
a commission.
Nothing ever comes from a commission.
It's just all that comes from it is more jobs for white people. They love a commission.
And then to be seen to be doing something, but doing absolutely nothing at all. So then what happens?
That commission, if you go to the office now, they've been on YouTube.
They love a commission.
Watching different videos.
They love a commission. But yeah, the documentary is literally at the end now. It's wrapped up really nicely. Dr. Ronk says...
Wrap it up then.
COVID in itself as a virus is not racist, but what it has done is illustrated that there are racial biases within this country that have existed and been neglected and ignored.
And that's on period. Like, what else do I need to say?
We could have literally said that.
We could have stopped it there.
That was the whole documentary.
Exactly.
Literally.
And that's why I think it was good to mention that in the title is not inflammatory, but it's
grabby.
Yeah, it grabs your attention because it's COVID rate. Yeah. Not grab about a pussy. But yeah, so it kind of grabs your attention.
Can you believe the president of America really said that he grabbed him by the... How do you even grab someone by... This is very Belinda Blinks.
No, but Belinda Blinks.
But
it's not that the president of the United States grabbed somebody by the pussy. It's that a man said that he did and then became the president of the United States. Which is even more wild.
Yeah. But the thing is how? I really... Guys... Okay.
Like this, you just grab...
Okay.
Like that.
So
I would imagine.
I mean, there's the arm, there's the...
If you can grab your own pussy, that makes sense.
Yeah.
But I don't reckon you can grab the pussy of another.
But somehow Trump did it. He summoned all his fake tan.
All his
strength,
the spirit of
the fake tan. And...
Lord. Guys, I really recommend...
somehow we made something that should have been quite heavy, quite light.
Yeah,
but
we do well. Yeah, we do well. We do well. I would recommend trying to watch the documentary if you can.
Yeah, it's really good.
But if not, we did actually do quite a good job covering it. So this should be sufficient if you can't find it.
We do say so ourselves.
But I think Dr. Ronks did a great job. Yeah. Did a great job. When they said that they were doing a documentary, I said to myself, mental note, I need to watch this. Because the way they were speaking when I met them, I was like, this will be good. Yeah. So I'm glad that I found it. Yeah. I will. I'm not sure that they remember me, but I'll message them anyway. But hey, I don't know if you remember a random black girl, and I don't know if you remember. And I was wearing a mask and everything, so they probably don't even know that I. But who is this bitch? But yeah, guys, what are we doing next?
A credits.
We are doing a credits episode. It's funny how, because obviously our upload was not obvious at all, actually, if you're listening. But our upload day is Thursday, and it just so happens that this year, the 31st, which is the end of the year, is on a Thursday. So we figured we would just do a credits episode talking about, what we want for the year and just recapping and just going over stuff and just, you get to hear our voices for a little bit longer.
Before we then.
So there will be no trailer this episode because there's no documentary next episode.
But we could do some bloopers for them.
We can do bloopers. Oh yeah, we've got bloopers. We've got bloopers. Good luck. Let me know when you're tired of them.
Good luck.
And where can they find us?
They can find us
Wow.
They can find us on 2 Girls 1 Doc on Twitter and Instagram.
And Facebook. If you're 40 plus.
Yeah.
And where can they find you?
4 rounds with 2 underscores on Twitter and Instagram. And also you can find me on Character Replay on Twitter and Instagram.
Oh yeah, that'll be starting. So basically when you're listening to this, it'll be the week after.
Yeah.
No, the week after the week after.
Yeah.
Because the week after will still be We'll remind you though, so don't worry. Yeah.
Headphones near you.
I am on Instagram and Twitter at BDOnEyewear and also BDOnEyewear.com. Also, we did our first collaboration with another podcast the other day. And you can listen to that episode. We're basically talking just pop culture and stuff that we'd normally talk about, but obviously we want to do up documentaries here for you guys because we know that you love it. So we will link that in our bio. We'll link it. So you can listen to it too. It's a great podcast as well. It's called Off the Cuff Podcast. So yeah, you can listen to that as well.
Some lovely chaps.
Lovely chats. All right, guys. Well,
Courtney.
Yeah, Kourtney Kardashian. Here are the bloopers, and we will see you guys next week.
Toodles.
Thank you for listening. Thank you so much.
Bye. Guys, I wanted to sing a little song. It's all working for the greater good. You can send my record deal to my lawyer.
Okay.
Do you send it to lawyers or just email it to me?
The lawyer that they will contact to sue you for wasting their time.
Oh God, this is the end of the year. I'm feeling very silly, Billy.
Do you know loving mince pies is not a personality trait?
Do you know not liking them definitely isn't one?
You didn't. I should just put it all in my mouth because it was a mini one as well. I should have just eaten it like that because I gave myself time to think.
I was about to say something filthy.
Of course you were.
Feisty one you are.
Feisty one you are. Okay, are you ready?
I'm ready.